Hi gang, Dr. Steve here with Kinesi, and here is your Wiggle for the Week Part 3 as we're talking about the knees. Now, in the first video, we went over some localized mobility for the knees, and we did squats in a variety of positions. We went through all sorts of things. We talked about how you could give yourself more support for taking the load off of the knees. Then in the second video, we went into some lunging where you're weight shifting in different directions. And we went all over the place where you're allowing your knee to go through a little bit of bending as it's the shock absorber for the lower part of the body, the whole body in fact. This week, we're going to integrate that knee motion even further into whole body movements where we're going to do a balance reach. Same pattern that we've been doing with the lunges. So what you're going to do is you're going to take a step out, lunging forward, but then you're going to balance on that leg, a little bit of a knee bend, and come back. We're going to do all the same directions. So we went forward in the sagittal plane, we went back in the sagittal plane. We're going to go same side lateral in the frontal plane, opposite side lateral in the frontal plane, same side rotation in the transverse plane, and then opposite side rotation in the transverse plane. So we're going in each plane of motion, we're lunging, you're shifting weight onto that leg, and then you're balancing and seeing if you can control your motion a little bit more. So we're going through all the different angles, forward, back, side, opposite side lateral, same side rotation, and opposite side rotation. And of course you may be wondering, that's great, but how do I make it a little bit easier? A couple of ways. Same strategies that we've used the last couple of times. Get some extra support. So here are just the trusty sticks that we can use. You can do these same motions hanging on to the sticks for a little bit of extra balance. If it feels like the stick or two sticks aren't quite enough as you're going through all the different directions, you can use something a little bit more solid, like the chair or the countertop or a wall. So you can still hang on and go through and do these in different directions. So you want to hit all the directions still, but hanging on to something a little bit more solid. Now, say you want to go to the other end of the spectrum and you think, okay, well, I've got that, that's pretty easy, I can do that. How can we make it a little bit harder? Add the hands reaching in a different direction. So why don't we add the hands reaching out in front of the leg and see if you can touch the ground. So it'll look like this. So you lunge, balance, reach to touch, and then you'd come back. We do all those same directions as we did, where you're always coming back to center, out to the side, balance and reach, opposite side, balance and reach, and then same side rotation, balance, reach down, and opposite side rotation, balance and reach down. We would do these to help the knee work better, to help you function better. And as you move places, you have to be able to control that motion. So that's really what the balance is all about. We need to control the motion, and for the knee to function well and be healthy, it needs to be able to help stabilize you, control your motion so that you're not going to topple over. Now remember, for the month where we're focused on the knees, anybody, friends or family, somebody you care about, anybody with a knee issue can come in for a free screening. Just give us a call at Kinesi. You can email, you can text. The information is there on the website and on the Facebook page. So come in for a free assessment. We'll figure out what's going on with the knees and come up with an individualized movement prescription specific for you. I will see you next time, and wiggle your way through life.